Hi, my name is Ariana Vega, and today I'll be talking about pneumonia, which is a very common but potentially serious infection of the lungs. Pneumonia can affect people of all ages and is caused by several different types of microorganisms, including bacteria, viruses, and in some cases, fungi. According to the CDC, pneumonia remains one of the leading causes of hospitalization in the United States and continues to be a major cause of illness worldwide. The signs and symptoms of pneumonia can vary from mild to very severe depending on the person's age, overall health, and the organism causing the infection. The most common symptoms include fever, chills, coughing that produces mucus, chest pain when breathing or coughing, and trouble breathing or shortness of breath. Many people feel extremely tired or weak, and some may experience nausea or loss of appetite. The symptoms occur because the infection causes the air sacs in the lungs to fill with fluid or pus, which makes it harder for oxygen to reach the bloodstream. According to Mayo Clinic, this is why pneumonia can become very dangerous quickly, especially in young children or older adults. Now, pneumonia can be caused by a wide range of microorganisms. The most common cause is bacterial, especially Streptococcus pneumoniae, which is responsible for many cases of community-acquired pneumonia. Viral pneumonia is also very common and can be caused by influenza, RSV, and less commonly, certain coronaviruses. For people with weakened immune systems, fungal pathogens like histoplasma can cause pneumonia that may become severe without treatment. The National Institutes of Health notes that pneumonia acquired in hospital tends to be more serious because the bacteria involved are often antibiotic resistant and the patients are more vulnerable. This variety of causes is why treatment depends so much on identifying what organism is involved. Now, the development of pneumonia begins when a pathogen enters the lungs, usually through inhaled droplets from someone who is sick. Once inside, the organism triggers inflammation in the alveoli, the small air sacs where oxygen exchange happens. This inflammation causes the alveoli to fill with fluid, mucus, or pus, which blocks normal breathing. Because the lungs can't bring in enough oxygen, the body starts working harder to breathe, which creates symptoms like chest pain, coughing, and shortness of breath. In severe cases, the infection can spread to the bloodstream and cause sepsis, which is very life-threatening. According to Nestor's microbiology textbook, this process can progress very quickly in high-risk individuals. Pneumonia affects people all over the world and remains one of the top infectious causes of death globally. The World Health Organization reports that pneumonia is especially dangerous for children under 5 and adults over the age of 65, particularly in areas where access to vaccines and medical care is limited. In the US, pneumonia is most common during the fall and winter months when viruses like influenza and RSV are circulating. Viral infections weaken the respiratory system, making it easier for bacteria to enter the lungs afterward. This is why you often hear that pneumonia is a compilation of the flu. Certain factors such as smoking, chronic health conditions, and weakened immunity also increase the risk. The treatment of pneumonia depends on what caused the infection. Bacterial pneumonia is usually treated with antibiotics, and most patients improve within a few days once treatment begins. Now, viral pneumonia, such as pneumonia caused by influenza, may be treated with antiviral medications if it's caught early enough. Fungal pneumonia requires antifungal medications and often longer treatment courses. Prevention plays a huge role in reducing pneumonia cases. Vaccines, not just the pneumococcal vaccine, but also the influenza vaccine, significantly reduce the risk of developing pneumonia. The CDC strongly encourages vaccination because vaccines protect not only the individual receiving them, but also vulnerable people around them. Good hygiene, washing hands, covering coughs, wearing masks when sick, and avoiding smoking all support lung health and help stop the spread of infection. The Christian worldview emphasizes caring for others and protecting the vulnerable. Pneumonia is a disease that can spread easily, especially to people who are elderly, young, or immunocompromised. When we choose to follow prevention methods like getting vaccinated, staying home when sick, and educating others, we are serving our communities and living out Christ's call to love our neighbors. Philippians 2:4 says, each of you should look not only to your own interests, but also the interests of others. Preventing the spread of illness is one way we do exactly that. Taking steps to protect others from pneumonia is a form of compassion and stewardship that reflects Christian values. These are my references. Thank you for watching.